Hello friends, this A is the picture of tension pneumothorax. How are you going to diagnose it? See, this is that radiolucent or jet black space which you can see here is definitely a pneumothorax. Here this is the collapsed part of the lung which you can see. Following the transbronchial lung biopsy, there is development of tension pneumothorax. Because it is tension pneumothorax, the air enters the lungs, but it is difficult for the air to pass out of the lungs, and as a result, this air is causing pressure over the lung, causing this collapse of this lung, and it also shifts the mediastinum to the opposite side. So even the heart is shifted to the left side here in this picture. So once you have done a pleural tapping, you will see that the mediastinum and the diaphragm will come back to their normal position. Even in the picture A, because of the air which is entering into the pleural cavity, because of this exerts a pressure on the diaphragm. So the dome of the diaphragm is also decreased downwards. So this is the picture showing tension pneumothorax. Thank you guys for watching my lecture. Thank you.